Aloha, I am Dr. Elisa Kim, and this is Everyday Wellness. We're joined by Dr. Kristen Coles today, and she's a naturopathic physician and a licensed acupuncturist, and we'll be talking about the adrenal gland. Thank you for coming on the show.
Yeah, thanks for having me.
Great. Well, can you tell us where the adrenal glands are and what they're for?
So the adrenal glands, we actually have two of them, and they sit on top of our kidneys.
Right.
So most of us have two kidneys, one on the right side, one on the left side, and the kidneys look like these little beans.
Right.
And the adrenal glands are kind of like a little Santa hat on top of the kidney itself.
Right.
And the adrenal gland is another endocrine gland, so it belongs to this system of hormonal messengers inside our body. And I like to think of them as our bank account.
Right. Right.
So the adrenal glands, we're born with sort of a great amount of adrenal gland function. And that's kind of like we're born with a really good bank account. And what does our bank account do? It allows us to, do the things we want to do, have energy, stay, in a healthy weight, have really nice skin, have a good functioning brain, have a healthy libido, all these things that, make living feel good.
Yeah, and give you a quality of life. Right.
Yes.
And if I always think the adrenal glands are kind of like the kidney glands or kidney organs, where the health of the mother is extremely important at the time of birth, because what if she is under stress the entire pregnancy, even before conception type of thing, then most likely your bank is going to be a little bit more deficient than it really should be. Your full potential would not be expressed in a way. So you only have that supply of whatever you're born with, and do you just continue to deplete it out, or do you do things to replenish it because you cannot add on to more than what you're born with?
That's right. And that's what I always like to talk with my patients about, is because we understand that analogy of a bank account.
Right.
In order to have a healthy bank account, you can't just withdraw, right? You've got to put some money back in.
Darn.
I know, right? Wouldn't that be great? It's the same thing with the adrenal glands. These glands that make a very specific hormone called cortisol and DHEA, we'll talk a little bit more about those. That's our money. That cortisol is our money. And we have to do things as we go through life to help replenish the adrenal glands, because if we sort of are under stress, our entire sort of, starting at maybe middle school, high school, college, I don't know, whenever people start getting really sort of understanding the stress of life, that's when our adrenal glands start really kicking in. And they will overproduce for us, and often for many years. As we're running around in a world full of stress, and we're stressing ourselves out, and we aren't getting enough sleep, and we aren't eating 3 meals a day, and we are drinking a lot of caffeine or caffeinated beverages, and we are burning the candle at both ends. Every time we are doing that, we are withdrawing from our adrenal glands, and we are withdrawing in sizable amounts, and we are not putting a paycheck back in.
Right. And this is one of the reasons why I get quite a few calls, from the visitors coming to Hawaii, because here they work, and they're just always going. And as soon as they come to Hawaii, it's almost like they do not have the adrenaline glands to protect them any longer. So as soon as they let go, it's almost like everything starts to happen. All the bad things physically, right?
Yes, and that's actually a very specific sign of a maladaptive stress syndrome, and actually like a stage 2 to stage 3, which is a pretty significant issue with the adrenal glands. It's the people who in college, they'll say, well, I was like fine all semester, and then as soon as finals ended, I came down with the flu. And I was like, my 2 weeks of vacation, my 2 weeks of Christmas break, I was miserably sick. That is your adrenal glands, and that is an issue with your cortisol function and your ability to deal with stress on a hormonal level.
And we just sort of look at it as, it's a norm. You know, if you stress a little bit, then you're going to get sick, and that's just normally what happens, and then we just get back and start doing things over again. So as important as these adrenal glands are, we really don't talk about them, and we don't really do a whole lot really to protect them and prevent them from depleting. And most of the people don't even know how to replenish them, except for maybe sleeping those extra hours to make up for the hours that's been lost, right?
Yeah.
So how do these adrenal glands work?
So the adrenal glands are also in this endocrine system where the brain plays a crucial role in the gland and the hormonal functioning itself. Okay, so the brain is constantly checking to see how much different hormones we have running around in our blood, and then it will send out signals to the adrenal glands and try to help balance the level of the active adrenal hormone, which is cortisol and DHEA as our main ones. Sodium, potassium, and some of the mineral corticoids are also something that we'll look at and discuss, but I'm really going to talk a lot about the cortisol and DHEA.
Okay.
And a normal functioning adrenal system is the following. The cortisol rhythm has a diurnal rhythm. It should peak in the early mornings, around 6 to 8 a.m. We should have cortisol secretion from the adrenal glands at its highest. That should wake us up naturally, give us energy when we wake up, stimulate an appetite when we wake up, and stimulate a bowel movement. These 4 things should happen every morning, kind of like clockwork, for an individual who has a healthy, functioning cortisol system. So they should, then get out of bed, and they should feel good. They should eat something, and then they should, start their day, and then around noon they should get hungry again, and they should eat, and then they should go throughout their day. They should not have a mid-afternoon crash in energy. They should actually have a little blip up in their energy mid-afternoon because cortisol blips up in mid-afternoon.
Well, that's not the case for most people.
No, it's
Many
not.
people, right?
I
Because
know.
they always say after lunch they are tired. They want to take a nap, or they need to have that chocolate bar or something, right?
That second espresso, whatever it is, it's
Yeah.
very common, and that is a huge signal for me that their adrenal glands aren't quite normal.
Yeah.
And then, we should go through the day, we should have dinner, and then, about 3 hours after dinner, we should be sleepy, ready for bed. We should go to bed, and we should fall asleep easily within 20 minutes of our head hitting the pillow. We should sleep soundly throughout the night until we awake again the next morning, maybe around 6 a.m.
Right.
That is a normal functioning cortisol rhythm.
Great. Great.
Majority of my patients walking into my office are not experiencing that, and that's what brings them in.
And why would we not, right? Because
Yeah.
we're supposed to experience all these things, but I know that we life, a thing called life, gets to us, and years of just bad habits will pretty much ruin that rhythm, the body's clock, and we can no longer be working those hours just like the way we're supposed to. So then what happens to the actual adrenal hormones when this happens chronically?
Yeah. So there are different stages of sort of deficiency that the adrenal glands experience, and that's called the maladaptive stress syndrome, and there's actually 3 different stages. I'm not going to get into the details, but suffice it to say that each stage has a certain acuteness or chronicity associated with it, and each one is treated a little bit differently from my standpoint.
Okay.
And the final stage is actually called adrenal exhaustion. So kind of like a collapse state. And these people, they have been under stress for so long, and they have not replenished their bank account for so long that they are actually in a state where we begin to see chronic fatigue, fibromyalgia, some pretty significant disease states develop that are actually traced back to the adrenal glands. But before we reach that stage, we actually get into different parts where sometimes we're actually overproducing cortisol. We're not deficient yet, we're just actually producing too much. And that is the first sort of response stage to chronic stress. Cortisol, adrenaline, and epinephrine are all related. Now, adrenaline and epinephrine, you may have heard of. They're those fight or flight response.
Right.
So if the the shark is attacking under your surfboard, the first thing that kicks in is your adrenaline, and that is sends all the blood to your muscles and allows you to sort of like run as fast as you can, swim as hard as you can to get away from the bear.
And you feel that dizziness. I mean, you almost feel lightheadedness, from having so much of the adrenaline kick in to your body. That happens quite often, whether it's in sports or whatever it may be. But when it happens chronically and all the time, where the body doesn't actually turn off the signal to shut down the adrenaline, then what happens?
So when we are actually in this chronic state of stress, and we feel that way all the time, but there's actually no bear chasing us, there's no shark under us, there's nothing there, we will eventually release so much cortisol over time that we then get to a state where we don't have enough cortisol anymore. We've actually gone into exhaustion. And the symptoms of having sort of overexpressed cortisol is that we get blood sugar imbalances. So we start getting crashes after we eat, and then we start craving sugar. That's cortisol issues. We have difficulty sleeping. We can't fall asleep. We can't stay asleep. Both start to happen. That's chronic issues with too much cortisol that's being produced at an improper time at night. And then sometimes we don't have enough cortisol during the day, and then we start using caffeine. Now, caffeine is, if we think about our bank account idea, caffeine is basically like overdrafting. So you're writing a check that you don't have the money for, but you're writing it anyway. And that's what caffeine is doing. It's acting like, we have we're gonna have like a little bit of cortisol that we're gonna take sort of externally, and it's gonna give us like a bit of energy for a minute, but then if we will crash. And so caffeine, I am always recommending that anyone with any adrenal issue, which is most patients nowadays, should cut their caffeine by 50% or more, depending. Because caffeine is actually a drug, and it should be used like a drug, meaning if there's certain times that you need it, like right before the final, or right before your big soccer game, maybe you have a little caffeine. But using it on a consistent day in, day out basis is not conducive to good adrenal health.
Which makes a lot of sense. But many times, I don't even think a lot of patients are in denial, by using the caffeine. It's mostly that they're completely unaware, what it does to your body, because it just tastes good and it gives you that buzz, right? So,
and it's addictive, and so then there's all those other issues. So often people really don't like to hear me tell them to change their caffeine intake. I become very unpopular in that regard. But if we're really focused on the adrenal glands and really need to rehabilitate the system, we need to look there. The second place we have to look at is the diet and the blood sugar balance. If we do not eat our regular scheduled meals every 4 hours, if we do not keep our blood sugar levels up, our brain will sense that. And when our brain senses a drop in blood sugar, it stimulates epinephrine and adrenaline, those fight or flight responses, in order to secrete more glucose from the liver. Often when people wake up in the middle of the night and they have sort of a racing mind, or they have some anxiety and they just wake up wide awake, it's because they have probably not had breakfast, had caffeine instead, went throughout the day, maybe had their first meal around 10 a.m. or around lunch, then had sugar in the mid-afternoon, and then maybe had an okay dinner but had too many carbohydrates, and then maybe they had a glass of wine, and then they went to bed, and then their cortisol, adrenaline, epinephrine system wakes them up at 3 a.m. This is very common. I'm sure there's someone out here listening who that exact thing happens to. That's your adrenal glands. So, if you go in to see your medical doctor and tell them all these sort of things, like maybe you just don't have enough energy, or you feel like you're getting some like midsection weight gain, but you're not really getting it anywhere else. You're having some issues with your skin. You're feeling just a little bit of anxiety all the time, you can't sleep well, most likely they're not going to look at your adrenals.
Yeah.
And probably not going to do a lab workup of your adrenal glands. It's very rarely done.
Very rare.
It's maybe I can count on one hand the number of patients who've actually brought in labs to me that have looked at the adrenal glands from a conventional medical doctor. So these are some really important things that I educate my patients about and then say, I think we need to look into your adrenal glands and I think we need to help your bank account.
Right.
And you know, who doesn't want to help their bank account?
Right, exactly.
Right. So testing that I'm going to run can be a couple different ways. We can do serum, which is blood levels of your cortisol and your DHEA. I will also do a 24-hour salivary test. It's called an ASI test, an adrenal stress index test.
Right.
And that's where you're actually doing saliva samples every few hours, and then we're looking at it over 24 hours to see, you know, what I just talked about. Cortisol high in the morning, comes down, blip up in the afternoon, go down overnight. We can actually see the entire pathway and then help rebalance your system accordingly. Now that test isn't covered by insurance, so sometimes I start with just the serum blood levels of a morning cortisol and DHEA, go from there, and then, you know, hopefully do an adrenal stress index salivary test to sort of gather all the information. And then, you know, I will institute treatment.
Okay. And what are the treatments look like?
So treatments are always going to take into the foundation of health into account. So that's sleep, stress, diet, all the things I just talked about. So I'm going to address all of that. And then the great thing with the adrenal glands is that they're very responsive to things like herbal medicine, so different botanicals, and nutrients. So the adrenal glands actually concentrate vitamin C. So vitamin C is really very important for the adrenal glands as a nutrient. And then some herbs that are, they're called adaptogenic herbs. So they are herbs that help us adapt to stress. And herbs like ashwagandha, Siberian ginseng is actually one of the best ones, and it helps support your adrenal glands. It also helps give us energy. Maca root, some people have heard of maca root from Peru. Rosemary, actually, a common culinary herb, very, very useful for a specific stage of that adrenal gland fatigue and deficiency.
Perfect. And that's something that you can do at home.
Yep, you can do rosemary tea, you can add it to your cooking. And then, you know, I like to have my patients on different blends and other nutrients that they're going to take on a sort of daily basis. It takes, depending on how long the issue's been going on, it can take 6 months to a year to longer to rehabilitate the adrenal glands. Generally, when I see a woman come into my practice with adrenal gland symptoms, they're generally mid-30s or early 40s. Sometimes late 40s to early 50s, but they are often experiencing really bad menopausal symptoms. If a woman has burned out her adrenal glands, menopause will be very, very uncomfortable for her. The adrenal glands pick up the slack after the ovaries, which is another endocrine system. After the ovaries basically go on permanent vacation, the adrenal glands have to pick up the slack. And if the adrenal glands have been pushed to the edge for the last, 40 years, and they're not in good shape, menopause is going to be very, very difficult. Lots of hot flashes, lots of symptoms, and that will generally, we need to look at the adrenal glands in addition to their hormonal system.
Well, the adrenal glands can also